Hello friends, today we are going to discuss our medical discussion episode number 24. Today we will discuss on halitosis. We will discuss what is halitosis and what is the cause and treatment. So my first question is to you that what is halitosis and what is the sign and symptoms and causes?
So halitosis is nothing but the bad breath of a person. When a person speaks or when a person exhales, when the people around him they get a bad odor coming out from his nose, coming out from his mouth, that is halitosis. Now, the main or the most important cause of halitosis, it is limited to the oral cavity. So, when the oral hygiene is not maintained, when there are certain dental problems, so it can lead to bad breath or halitosis. Normally, when a person has some dental problems, like there can be tooth decay, there can be food in between the teeth. So the bacteria present in the mouth, it usually ferments that food and it leads to the bad odor or halitosis. If a person doesn't maintain the oral hygiene, there can be growth of excessive growth of abnormal bacteria in the mouth, and this also leads to the growth of formation of some formation of some fungal growth or bacterial growth inside the oral cavity, which ultimately lead to the development of bad breath or halitosis. Sometimes there can be dry mouth because of the lack of the salivation. With age, there can be reduction in the number of salivary glands or the minor salivary glands, which ultimately lead to the decreased production of saliva, and because of less production of saliva, there can be imbalance between the normal and the abnormal flora in the oral cavity, which leads to the formation of bad odor, which we call as halitosis. So these are mainly the oral causes of halitosis. There are certain other systemic causes or other diseases which can also lead to the formation of bad breath. Most important is the infection of our sinuses. There are certain hollow cavities inside the skull. These are called sinuses, and if there is infection in the sinus, which we call as sinusitis, it can also lead to the development of halitosis or bad breath. Certain foods, mainly the strong foods like onion, garlic, or the excessive spicy food, even excessive intake of alcohol or coffee can also lead to the development of bad breath. Certain medications like certain nitrates, which are mainly used in our heart problems, can also lead to the development of bad breath or halitosis. Now, there are certain other systemic diseases like diabetes. If the sugar is not controlled, then there can be growth of abnormal bacteria not only in oral cavity but also in the other parts of the body, and this can also sometimes leads to the formation of bad odor or bad odor coming out from the mouth or the nose. Sometimes some infections of the stomach, like H. pylori infection, there is a bacteria called H. pylori which usually resides in the lower part of the stomach, and excessive growth of that bacteria can also lead to the fermentation of the food and can lead to the formation of bad breath. Sometimes gastroesophageal reflux, that is when the food or the acid reflux or regurgitates in the food pipe, can lead to the development of halitosis. Even some diseases of the lung, because the air that is exhaled, it comes from the lung. Some diseases of the lung, mainly the chronic infections, pneumonias, or bronchiectasis. Bronchiectasis is that diseases where there are certain formation of holes inside the lung parenchyma, and there can be infection in these holes or in these bronchiectatic parts, and because of that infections, there can be formation of bad breath, which ultimately lead to the halitosis.
Thank you, sir. So how can we diagnose halitosis for the further treatments?
Normally, for the diagnosis of halitosis, we usually not doctor is not required every time. We sometimes ourselves can feel the bad breath, or the people around us can complain that whenever we exhale or whenever we speak, then they can feel bad breath coming from our mouth or the nose, or otherwise we can do one thing, that we can lick the upper part of our palm and let it dry and can smell ourselves, and if it smells very bad, then we can think that we are suffering from halitosis or bad breath. There is also a term called halitophobia. This is usually a psychological disease. That means the person's breath is usually normal, but he himself thinks that he is having bad breath or halitosis. This is usually a psychological condition, often termed as halitophobia.
Thank you, sir. How can you treat, what is the treatment for this halitosis?
Normally, the treatment depends on the cause. Usually, I have already said that the most important cause of halitosis is the unhygienic maintenance of the oral cavity, or the inability to maintain the oral hygiene. The dental problems or the dryness of the mouth often lead to the halitosis. So, when a person have bad breath, he should consult a dentist immediately and look after his teeth, or if there is any tooth decay, he should immediately treat it. Moreover, he should continuously flush his mouth, rinse his mouth, or gargle continuously even after every meal, and that will lead to the reduction in the number of the bad bacteria inside the mouth, and this will help to prevent bad breath or treat halitosis. If the person is suffering from sinusitis, he should immediately treat that. He should also look after the other systemic diseases. Suppose he is having chronic cough, he is having lung problems, he should consult the doctor and treat accordingly. Moreover, if he is taking any strong medicines or strong food, he should immediately try to avoid that type of food, like onions, garlic, strong spicy food. Or if he is taking any medicine that causes halitosis, he should try to take take any other alternate medicines. He should also see that if a person is suffering from diabetes, he should look after his sugar and try to control the sugar within the normal range. If the person has some stomach problems, he should go for an endoscopy of the abdomen to look for Helicobacter pylori bacterial infection. Or if he is having GERD, he should go for a treatment of the GERD. If the person is having, if the person is addicted to alcohol, or if he is smoking regularly, he should consult a doctor immediately and try to stop those type of addictive substances as early as possible. So these are mainly the treatment of halitosis. The treatment lies on the cause of halitosis. It's important to identify the cause of halitosis and treat accordingly.
Thank you, sir, for the valuable, wonderful session. We had learned so many things. So, what would you like to request or advise to the audience?
So halitosis, it is usually a very common problem that we encounter in our OPDs. Most of the people, they usually feel shy to tell about it, or if some people suffer from it, they usually end up in inferiority complex. So there is nothing to be worried about halitosis. It is usually, the cause usually lies in our oral cavity. Sometimes there can be systemic causes, sometimes the cause lies in the food or the things we eat. So modifying those factors, treating those factors usually cures the condition. So we hope that this video will be very useful to you all. Hope you will all like, share and subscribe the channel. Thank you all.
Thank you.